Hello, and thank you for tuning in to STL TV. I'm Jade Harrell, here with Acting Director for the City of St. Louis's Department of Health, Dr. Fredrick Echols, and members of the City of St. Louis Department of Health Clergy Advisory Board, here to speak about World AIDS Day. Thank you for joining us today, Dr. Echols and Dr. Turner. Thank you both.
Our pleasure.
Let's talk about World AIDS Day. Why is it so important to health equity in our community and the world?
So World AIDS Day is gives us an opportunity to acknowledge the impact that HIV and AIDS continues to have on our community, particularly our most vulnerable populations. And so by taking time to acknowledge the impact of HIV, we're able to develop, acknowledge the impact that it's having, but also use this opportunity to create a platform that allows us to better and more effectively address issues related to HIV.
For sure. It was one of the earlier pandemics for our community and the world, actually. What are some of the challenges with preventing AIDS and HIV?
Yeah, I think some of the challenges, there's still huge stigma and fear. Some people, fear getting tested, fear that the results may be positive, fear that other people may find out that they got tested. So trying to reduce that stigma in our community and to let people know, treatment and our approach to HIV/AIDS is completely different from years ago. I think the biggest thing is trying to reduce that stigma and create more of a welcoming environment so we can connect people to care, connect people to churches and to housing and jobs, and to be more of a supportive, compassionate perspective, and not stigmatizing people.
Understood. Is this where the Clergy Advisory Board comes in, making those connections and resources available?
Absolutely. So communities of faith are pillars in our community. However, when we talk about sexually transmitted infections, including HIV, there's oftentimes a lot of stigma attached with that, and particularly in faith communities. And so working with the Clergy Advisory Board, which is a group of individuals that represent different faiths across the city of St. Louis, really helps us get the message that the health department needs to get to the community at large, but more specifically to our populations that are most heavily impacted by HIV.
Understood. Dr. Turner, let's help dispel some of those myths and the stigma that has previously been associated with HIV/AIDS. What are maybe 2 or 3 things that we can dispel and help people maybe get over by hearing some new information?
I think one of the biggest myths people are, they look at it more so as transmission based on, same-sex couples. There's still a lot of huge stigma with that, but really getting the message out that anyone can be at risk of contracting HIV, but not being afraid or scared to get tested, either yearly or just, getting tested. And if you get tested, treatment is completely different. We talk about that your viral load is undetectable, meaning, that it's not transmissible. And a lot of people, if they hear somebody that have HIV, they're afraid to even shake their hand. So changing that perspective, and, we're all humans, we're all, just changing that.
Yeah. I'm certainly glad that you have a platform to be able to address this. What is one of the things you want people to walk away knowing for sure today, or how to connect with this platform and information?
So the one thing we want people to take away from the events of World AIDS Day is, one, that HIV is still preventable, but it's also, they need to know that sexual health and reproductive health is a part of overall health. So people need to make sure that they're getting the annual screening, following up more frequently with their provider if they're engaging in risky behaviors, and that people need to know that there are resources available to them through the City of St. Louis Department of Health, as well as some of our stakeholders, the HIV service provider organizations. We receive direct funding from federal agencies such as the Human Resources Services Administration. They give us at least $6 million annually to make sure that there are services available for those individuals living with HIV who are underinsured, uninsured, or meet certain eligibility criteria. And we work with quality service providers across the St. Louis transitional grant area, which covers 5 jurisdictions in Illinois and 7 jurisdictions in the state of Missouri, to make sure that there are access points for individuals wherever they may be within our transitional grant area.
That's fantastic. So good to know that you're on the charge, but that we also have so much help and resources available now. So there's no need to be afraid. Stick with us. We're going to take a quick break, and when we come back, we'll talk more about World AIDS Day.
This is the story of a boy who is very sensitive to lights and sounds. so he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help, and slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
And welcome back. I am Jade Harrell. I'm now joined by a few more members of the City of St. Louis Department of Health Clergy Advisory Board, here to speak more about World AIDS Day. We are now joined by Dr. Anthony Witherspoon, as well as Dr. Turner returning with us. Tell us more, Dr. Witherspoon, about the Clergy Advisory Board and how you came to be a part of it.
We decided that it was important and imperative that clergy be instrumental in associating with the clergy, with the health board and those that deal with health. And so what better medium to use than those persons who see members all the time. I came to be a part of it after being a member of the Ecumenical Leadership Council, because I believe in the tenets of what we stand for. And I definitely believe that we have to coordinate and collaborate with each other to make health disparities go away.
For sure. Can you tell me more about the tenets of what you were based on?
So our tenets are, we believe in making sure that people have an opportunity to have their rights heard, the justices of the world, and so on and so forth. And in so doing, we try to make sure that every person with equity has an opportunity to have their voices heard through even our Ecumenical Leadership Council. Another thing that we believe in making sure that our voice is not only a local voice, but a state voice and a national voice that will bring even some stability to St. Louis as a whole.
Absolutely. Dr. Turner, this sounds like an equity issue as much as it is a health issue, and maybe even more so. Talk about how the faith community can really help bridge the gap.
Right. So it's really important for us to engage our clergy and the faith-based community, and even take a step back just so you can know our faith community is made up of the Christian community. We got Judaism, Buddhism, Muslim as well. And so having multiple different faiths to come together to address important health topics and even public health perspective is really important. I think, for churches, people and pastors and clergy, community members often will look to them for their guidance, their support. And not only that, we know that our churches are huge pillars in the community. And, just hearing Pastor Witherspoon say something across the pulpit, you're going to listen to him. And so I think, engaging the clergy in that aspect, educating and teaching our clergy, and then they can be the messengers to take that message to the community with a spiritual connection too.
Mm-hmm. Here you are also in the medical community and a part of the advisory board as well.
Yes.
So they get the advantage of both of their higher powers in origin, so to speak. Tell me though, Dr. Witherspoon, why is the burden of HIV and AIDS so much higher in the Black community?
In our community, oftentimes we have a stigma around testing. We have a stigma around persons knowing our particular statuses, a particular status. We have a stigma around, even in the faith community, how people will be treated, even in the church and so forth. And so oftentimes, the church, especially the Black church, has failed in some ways in times past with acknowledging the fact that persons who are infected with HIV AIDS are right there in our congregations. And so therefore, we have to come full circle. We have to get over those things and realize that Jesus had a ministry of healing. And there was no certain disease that Jesus was limited to in healing. And so therefore, until we come to that point of understanding and realize that Jesus is a holistic healer, that we'll have some problems there.
For sure. So that's excellent from a faith standpoint. From a health standpoint, why is the burden so much higher?
Definitely, I do echo. I feel like a lot of it comes from the community, that stigma. So people, they will often, retract and get silent and don't want to speak on it or talk about it or reach out for help because of that stigma. And I would say for the health community, I do take care of a few patients myself. So I think my interaction in the clinic is a little bit different. But when I leave the clinic and go out into the community, it's a lot of hush hush and don't tell anybody. And it's more of a shameful or a guilt behind it. And that's what we need to change.
Absolutely.
So that people won't, live the rest of their life with trauma and that guilt.
Excellent. We do not want you to live your life in fear, trauma, or guilt. When we come back, we'll speak with Dr. Echols about the resources that are available to you, that you do not have to have fear and can connect with what you need for help. We'll be right back.
Maybe you can make retirement happen. After all, you made home ownership happen. Homeschooling yourself on loans, beefing up your credit score.
So I'm pre-approved.
You were like, yes! Sorry. Color coding listings, ticking boxes, and flushing every toilet in a 20-mile radius. Home sweet home. You aced house hunting. Now get the tips you need to get on track at aceyourretirement.org.
Do you want to know what city government is doing for you?
Yes, Mr. President. Board Bill 69 committee substitutes the budget bill for the Parking Commission. And this bill is a big deal and a great deal for the citizens of the city of St. Louis.
Watch STL TV, the city government channel, then you'll know.
And welcome back once again. I am Jade Harrell. Thank you for tuning in to STL TV as we talk about World AIDS Day and the resources available to you. I am joined by Dr. Fredrick Echols. Tell us more about the resources and the supports that you have in place as we talk about sexual and reproductive health.
So resources are really important. So as we talk about the inequities and disparities that exist, making sure there's just access to resources is really important. Oftentimes we talk about health equity, but health equity doesn't really address the root cause of the issue. And so by working with culturally sensitive partners across the St. Louis transitional grant area, we've been able to not only increase access to resources, but also access to culturally sensitive health care for individuals. And so the health department, we've also partnered with community partners such as barbershops and beauty salons. So we have a barbershop and beauty salon initiative where we provide free sexual health resources to barbers and beauticians across the St. Louis region. This is through our HIV prevention program. And so if there is a barber or a beautician or salon that's interested in participating in this project, they can contact the health department by contacting our Communicable Disease Bureau. They can call 314-657-1499. Again, that's 314-657-1499 to be connected to our condom distribution program. And we'll provide resources at no cost. It's unlimited, so you just let us know when you need the resource, and our staff will make sure that your supply, your inventory is replenished.
For sure. So is that our starting point with that phone number?
That's the starting point.
Okay. Any questions, any concerns or fears, start with that number.
Absolutely. And we're also working with our HIV, it's our Ryan White program, which is a federal program that's funded by the Human Resources and Services Administration. Early on I talked about the $6 million that we get each year. And so again, these funds are dedicated to making sure there's medical, social service support, as well as housing support services for individuals living with HIV. And so individuals who are maybe living with HIV and they are uninsured, underinsured, need access to a good medical home, they can contact the health department as well to get information about resources that are available through our Ryan White Part A program. And they can call the same number, which is 314-657-1499.
Give it to me one more time, Dr. Echols.
314-657-1499.
Fantastic. It sounds like that you're putting this in the forefront, being able to help our community, but also being sensitive to our needs as well.
Absolutely. We value our community, and we want to see everyone in our community thrive. And so in order to do that, we have to break down some of the barriers that have been created over the past. And so undoing some of the damage that has been done is a top priority, because again, we want to make sure everyone has an opportunity to achieve optimal health.
Thank you, Dr. Echols, for making that a priority and bringing the information to us today.
My pleasure.
For more information about World AIDS Day, make sure you contact the Department of Health at 314-612-5100 or email them at health@stlewis-mo.gov. Again, thanks to Dr. Echols and members of the Clergy Advisory Board for joining us today to speak about World AIDS Day. I am Jade Harrell. Keep watching STL TV and experience St. Louis.